in the pink or peach right there, men are challenged with identification, proper identification.
Why are Congress, the legislature and the Senate, why are they working so hard to accomplish getting this insurance, this coverage, all of a sudden? Why is it such an important thing? Anytime you rush into anything, it will never be done right. Why are you said that it had been going on for years and nothing had ever flown correctly. It never worked. Well, if that didn't work, learn from this. And it doesn't have to be done in the first 6 months of the year. It needs to have it. I'm opposed to this to begin with because I'm almost 70 years old and I know when health care was not handled in the federal government and it was affordable. Okay? We know that if you've got an insurance company and you've got me and you've got a doctor, that the charges are direct. But if you've got an insurance company and you've got the government and then you've got the billing company and you've got somebody else and you've got me and you've got the doctor, that's going to cost a lot of money. That does not even make sense. I was an accountant. I can tell you it does not make sense.
Wow, I found the one person in America who likes insurance companies.
Actually, when I had just an insurance company, it was cheaper.
I'll be the second.
It was cheaper. Okay? It really was. And I know that nothing stays the same. Okay? Life changes, things increase in dollars, blah, blah, blah. But it's ridiculous today to think that you can take the federal government and not blow this up eventually, especially since it's obvious that no one knows what they're doing. They didn't know what they were doing.
Well, they don't read it.
Why don't you go outside of Congress and ask the people that know?
I think the bottom line on this is that whether it's today, tomorrow, or next year, you are opposed to health care reform. You will be opposed to health care reform. And there's really nothing that I or anyone else can say to you about the other case.
And vice versa.
I think that this is an issue that people have been working on for decades, and the political opposition has always prevailed, whether
No,
it's
they
insurance
haven't.
companies or pharmaceuticals or other folks.
When did the
Now,
federal government start this?
If your point of view is the majority point of view, I suspect that health care reform will fail again. I personally think that would be unfortunate. There are a lot of people who could have better health care, and there are a lot of people who would not be exposed to those risks unnecessarily. I do think that this is a thorny set of issues to take on, and it is going to be very difficult. But this is an area where, because of how much more we can do today than we could do 10 years ago, or even 5 years ago, and certainly more than we could do 50 years ago when there weren't that many effective treatments for anything, things cost a whole lot more. This is now 16% of our gross domestic product, all the value that we create in a year. It will soon be, within the next 10 years, it will be 1/5 of our gross domestic product. And in 20 years, it's likely to be 1/3. Now, we may choose to spend that much on health care, but I hope that it is a thoughtful decision, and it's thought through with what we want to buy and what we don't want to buy, but we have a chance to work through what the incentives are so that, for example, primary care physicians who today are pressed to see a patient virtually every 5, 10, or 15 minutes, that they have some time to really spend with you, that they don't have to be a hamster in a turning page anymore, so that we're not reimbursing for complex procedures and reimbursing for that repeatedly, so that the income level of cardiologists is $450,000 and the income of a primary care physician is $170,000. There shouldn't be those incentives which potentially take away from patient care and good health outcomes. Now,